I'm Dr. Andrew Weil, the founder and director of the University of Arizona Center for Integrative Medicine, and I want to talk to you this morning about the future of healthcare and the role of integrative medicine in healthcare systems of the future. A number of speakers at this conference have mentioned the fact that healthcare is a responsibility of governments. It is in the interest of government to keep citizens well and healthy and to improve well-being. But the economic challenge of healthcare today is so serious and growing that it threatens the stability of governments. And I want to use the example of the United States, which I'm most familiar with, because the crisis in healthcare that's happening there is beginning to develop in most other advanced nations. The US is now spending 18% of its gross domestic product on healthcare. And that is going up. It's predicted to reach 20% in the next few years. That's unsustainable. At the same time, our health outcomes are worse than those of other developed countries. The World Health Organization ranked the United States 37th in health outcomes, on a par with Serbia. And that's any way you look at it. It's infant mortality, longevity, rates of chronic disease. So something is very wrong with this picture. We're spending more and more on healthcare, and we have worse and worse outcomes. So clearly, the message is that we're spending money in wrong ways. Now, I would argue that we do not have a healthcare system in America. We have a disease management system that's functioning very imperfectly and getting worse by the day. And the sad fact is that the diseases that we're trying to manage are mostly diseases rooted in lifestyle choices. They have to do with how people are eating, their lack of physical activity, how they handle stress or don't handle it. You know, all these factors that are really apart from the purely looking at the physical body. And it is a truth that modern high-tech medicine is unable to manage these diseases very well. The classic diseases that we're seeing of this sort are obesity, hypertension, type 2 diabetes. All of these are now epidemic in the United States, especially among young people. The obesity epidemic in children in the US should be a flashing red light telling us that we're doing something very wrong. Experts on type 2 diabetes are closely watching the epidemic of type 2 diabetes follow this development of an obesity epidemic in children. When I was in medical school in the late 1960s, type 2 diabetes was called adult onset diabetes. Then we changed the name to adolescent onset diabetes. Now we're seeing this disease develop in children as young as 3 and 4, preceded by massive obesity at ages 1 and 2. So something is very wrong with what we're doing in our society. And also experts on diabetes tell us that the cardiovascular complications of that disease typically appear 15 to 20 years after diagnosis. So that means that we can begin to see an epidemic of coronary artery disease in young men, something that we've never had to deal with before. Also, when I was in medical school, I was taught that if you see a young man in an emergency room with acute chest pain, you don't have to worry about doing an extensive workup because the chance that this is something very serious is small. Now, if you see a man in his 20s or early 30s with chest pain in an emergency room, you have to consider the possibility that this is a heart attack. This is a great change in patterns of disease that we've seen in our culture. The great challenge we face, I think, is how do we turn this system of disease management into a system of health promotion and disease prevention. And that is a great challenge for our society. And the forces that are impacting healthcare in America are building in all other countries, I'd say all other developed countries. And the reasons are, first of all, that people are living longer. We are seeing a graying of populations. Japan is ahead of the United States in this change, but this is rapidly happening in other advanced cultures. The oldest old are the fastest growing segment of the population. And as people become older, they become sicker and begin to drain the resources of healthcare systems. Secondly, we are trying to manage these diseases of lifestyle by applying the methods of high-tech medicine. Conventional allopathic medicine is very reliant on technology. I include pharmaceutical drugs in that category. And the methods of high-tech medicine are very successful in dealing with trauma, with medical crises, with acute conditions of all sorts. They are much less successful at managing the chronic diseases that are now becoming epidemic in our societies. So I think a fundamental change in the nature of medicine is required in order to meet the challenge that we're seeing of escalating healthcare costs and at the same time deteriorating health outcomes. Integrative medicine is one solution, I think, to the problem. And this is what I have dedicated my career to, and through the center at the University of Arizona, we have begun to train physicians in a new model of medicine that is not simply focused on the physical body. And let me review for you the fundamental principles of this new system. First, integrative medicine places great emphasis on the human organism's potential for self-regulation and healing. Now, this is not a new idea. This was enunciated by Hippocrates in the 5th century BC, who said that we should revere the healing power of nature. But that idea has been lost in our enthusiasm for technological solutions to all problems. To me, the most marvelous fact of human biology is that our bodies have the ability to know when they have been injured or damaged. They have the ability to regenerate tissue, to reestablish new equilibrium, to adapt to injury and loss. And that should be where good medicine begins. When I sit with a patient, always at the back of my mind, I'm thinking, why is healing not happening here? What can I do from outside to facilitate that process? Are there obstacles to healing that I can remove? Is there a way that I can give more energy to that system? Here's an example that I often use in teaching students. If you have a patient acutely ill with bacterial pneumonia, you put them in a hospital, give them intravenous antibiotics, and 48 hours later they're out of danger. It's very easy to interpret what happened as the antibiotics caused the cure. I would ask you to interpret that differently. What antibiotics do in that circumstance is reduce populations of germs to a level where the immune system can take over and finish a job that it could not do because it was overwhelmed. And to me, that's a model for how all of our treatments work when they work. They don't work directly, they work indirectly by impinging on the internal mechanisms of healing that we're all born with. And as I said, it seems to me that good medicine begins with emphasizing this fact that the human organism has a tremendous potential for healing, and that's where we should start. So that's the first principle of integrative medicine. The second principle is that human beings are not just physical bodies. We are also mental, emotional beings, spiritual entities, community members, and in order to understand health and disease, those other dimensions of human life have to be taken into account. At the moment, conventional medicine is dominated by the biomedical model, which assumes that all physical disease has physical causes and restricts its scope of analysis and treatment to the physical body. And in doing so, it restricts its vision and ignores often the true sources of health and disease, which can be only understood by taking a more comprehensive view. So this is, I think, one of the most important aspects of integrative medicine. You might call it whole person medicine, that is breaking out of the restrictions of the biomedical model and instead using a biopsychosocial spiritual model. And interestingly enough, it is a biopsychosocial spiritual model that has been an essential aspect of many traditional forms of medicine around the world, including traditional Chinese medicine, Ayurvedic medicine, traditional Islamic medicine, Native American medicine, and other systems which have had a more complete view of the human being. A third principle of integrative medicine is that we look at all aspects of lifestyle and trying to understand health and illness. That means inquiring about how people eat, how they handle stress, the nature of their physical activity, how they rest, how they sleep, the nature of their relationships, and so forth. And it is only through a careful taking of a lifestyle history that we are often able to understand the causes of illness and able to make recommendations that can help people remain healthy. I think this emphasis on lifestyle medicine puts integrative medicine in a very strong position to offer real prevention and health promotion, which conventional medicine is unable to do because doctors have not been trained to analyze lifestyle choices of patients or to present them with practical advice. A fourth principle of integrative medicine is that the interaction between the physician, health practitioner, and the patient is all important to eliciting a healing response. One of the great tragedies of modern medicine, I see this very clearly in the United States, is that as medicine has become incorporated into for-profit systems, the time allotted for physician-patient interactions has diminished. It is not impossible, but it's unlikely that if you only have 5 or 10 minutes with a patient, that you can form the kind of therapeutic relationship that fosters healing. So healthcare systems of the future must allow for a much greater interaction between patients and practitioners. And then finally, the final aspect of integrative medicine is that we are willing to look around the world and take from traditional systems of medicine, anywhere we find them, treatments that we feel to be useful. And as long as they don't cause harm, and we have reasonable evidence for efficacy, to incorporate them into the medicine that we practice. So an integrative treatment plan for a patient will always include recommendations for dietary change, information about exercise, use of dietary supplements, use of natural remedies, including herbal remedies, referral to practitioners of other systems like Chinese medicine or Ayurvedic medicine, mind-body therapies. This is a whole range of therapies, everything from hypnosis to visualization to guided imagery, to take advantage of the connection between the mind and the body. Conventional medicine ignores that connection, and again, only in looking at the physical body, does not see the great potential of using the mind to access the healing potential of the organism. So an integrative treatment plan is much broader than what conventional doctors would give, but it does not exclude conventional treatment. If drug therapy is the appropriate therapy, if surgery is the appropriate therapy, of course, integrative medicine will recommend that. But in addition to that, these other therapies will be recommended to make them more effective, to reduce toxicity of conventional therapies, to improve general health, to improve outcomes. I mentioned to someone as I was coming into the conference that a few years ago I was in Beijing and was taken to a very large hospital, Guang'an Hospital. The entire hospital is dedicated to integrative medicine. It's a modern hospital. It looks as modern as any hospital that I know in America or other Western countries. The largest department in that hospital was oncology. Every cancer patient in that hospital gets surgery, chemotherapy, radiation as needed. In addition, very sophisticated nutritional therapy, acupuncture, massage therapy, and most importantly, very sophisticated herbal therapy designed to reduce the toxicity of the conventional treatments, to increase their efficacy, to improve general quality of life and improve outcomes. I saw a number of patients were presented to me there. Their outcomes were very good. It made me sad to think that in my country, so few cancer patients are able to access that kind of care. And when cancer patients do ask oncologists about the use of dietary supplements or herbal therapies often, they're just reflexively told not to do it, that it will interfere with conventional treatment. So again, I think there's, in oncology, as in many other specialties of medicine, there's an enormous need to broaden our model, and I believe integrative medicine is the way of the future. In the US, it appears that we might see a complete unraveling of the healthcare system. As you know, there was an attempt to try to improve it under the last presidential administration, and that effort is now there's a now attempt to undo it completely. Patients are extremely unhappy. Doctors are extremely unhappy. It is not clear where this is going, but it's not going in a good direction. It's possible that the conventional healthcare system and conventional healthcare institutions will not be there 10 years in the future. And it's interesting to speculate about what might take their place. And I'd like to give you one vision that I have. It seems to me that conventional allopathic medicine, high-tech medicine, which I've said is very good at dealing with trauma, with medical crises, with medical and surgical emergencies, and so forth, that this might become a specialty. And it will be practiced, the practice of it will be restricted to large urban medical centers, which are the only ones that are going to be able to afford all the technological hardware. And many smaller and community hospitals may simply disappear. In their place, I would hope new kinds of healthcare institutions might come into being. And one of them that I envision, I would call a healing center. And I see this as something between a spa and a hospital. This would not be for the treatment of severe illness, critical illness, terminal illness, but they'd be places where you could go if you were not yet sick, where you could have your lifestyle analyzed. It could also be places where you could go for the management of routine complaints, back pain, headaches, allergies, autoimmune diseases, a whole range of conditions which are not well managed by conventional medicine. And I would see these centers as being under the direction of integratively trained physicians, but there would also be a team of allied health professionals that would include practitioners of Chinese medicine, of Ayurveda, of Islamic medicine, of mind-body medicine. I would also see this as places where you could stay, say you stayed there for 3 days, 5 days, a week, and when you came out, you'd know more than you went in about how to live, about how to eat, perhaps how to cook, perhaps how to grow some of your food, how to handle stress. You would learn practical information that would enable you to go out and live in a better way to reduce the chances of disease and optimize health. And very important, I would see stays in these centers being reimbursed in whole or in part by insurance. And this is a great stumbling block at the moment for integrative medicine, because as dysfunctional as our current healthcare systems are, they are generating a great deal of money, and that money is going into very few pockets. It's the pockets of the big pharmaceutical companies, the manufacturers of medical devices, and the big insurers. And those vested interests do not want to see anything change. At the moment, as I said, we at our center graduate physicians who are highly trained in integrative medicine. We have now graduated over 1,500 physicians from all specialties from these intensive 2-year trainings in integrative medicine. But then they go out into a world where the priorities of insurance reimbursement are stacked against them. We happily reimburse for giving drugs, for doing procedures. We don't pay a doctor to sit with a patient and give them advice about diet, to give them advice about exercise, to teach them methods of managing stress. That's what has to change. We have to change these priorities of reimbursement. And I think that can only be done by convincing the people who pay for health care that it is in their interest to pay for this kind of treatment. That in fact, doing this sort of treatment and emphasis on prevention and health promotion in the long run will save them money. For example, I said that one of our key points is that there has to be sufficient time for a doctor and patient to interact. At the moment, it's the physician's time that is the most inelastic element, economic element in healthcare. So when you try to talk to someone who pays for healthcare about allowing an hour for a first visit, they stop listening. They can't imagine how that could work. Our contention is that by taking that amount of time at the beginning, you will save money down the road because there will be lowered utilization of practitioners, lowered cost of treatments, and so forth. But that has to be demonstrated. And there is an enormous need at the moment for effectiveness and outcomes research in which integrative treatment can be compared with conventional treatment head-to-head to see how the two compare. And the way that I would do this is to pick disease conditions that now absorb most of our healthcare dollars. Things like chronic back pain, for example, allergies, pick forms of arthritis, in which we think that integrative medicine would shine. And you take matched pairs of patients, matched for age, gender, medical diagnosis. One of each pair goes to conventional treatment, one goes to integrative treatment. And then you want to compare outcomes in terms of medical outcomes, cost outcomes, patient satisfaction. And I am quite sure that if we did this, we can produce data that's very convincing that integrative medicine will be more successful and more cost-effective than conventional medicine. But it is not easy to get these studies done. They require large populations, they're expensive to do, and it's not clear who's going to pay for them. I think I would hope that perhaps corporations, which are now hobbled by healthcare costs, perhaps in collaboration with governments, could organize at least some pilot studies of this sort in which we can do this kind of comparative study of effectiveness and outcomes in order to guide the way that we reimburse for healthcare. But I thought I might give you an example of a treatment that I use very frequently, a recommendation in my own practice that to me is an example of the kind of thing that integrative medicine can find and bring into mainstream practice. I've become known as one of the few doctors who places a great emphasis on breathing. And in my own experience, I have found that regulation of the breath to be an extremely powerful medical intervention that is utterly simple, that requires no technology, it's free, and produces remarkable changes in physiology. And I'd like to teach you a simple breathing technique that I have found to be really, I think, the single most effective remedy in all of my explorations of alternative treatments. You know, all of these breath work, if you look around the world at areas where emphasis is placed on breathing, whether it's martial arts, systems of meditation, athletic performance, natural childbirth, and you try to find where did this information come from, all roads point to ancient India. This is I think, a true experiential science that developed thousands of years ago in India and has diffused all over the world. The theory of breath work is that breathing is the only function that we can do completely consciously or completely unconsciously. It's run by two different sets of nerves and muscles, by voluntary nerves and muscles and involuntary nerves and muscles. So the theory is that by imposing certain rhythms on breath with your voluntary system, gradually you can induce those rhythms into the involuntary nervous system. And breath thus provides you with a window through which you can influence the functioning of the involuntary nervous system. Otherwise, we don't have access to that. Many common health conditions are rooted in unbalanced functioning of the involuntary nervous system. That's true of high blood pressure, of many gastrointestinal complaints, circulatory problems, and so forth. So this breathing technique is, I think, a specific antidote for the imbalance that's most common in our societies today. And that problem is that the tone of the sympathetic nervous system, the sympathetic division of the autonomic nervous system, the one that prepares us for emergencies, for fight or flight responses, is set too high. And we'd like to reduce that and increase the tone of the parasympathetic nervous system, which is the one that has the opposite effects, the relaxant effects. And this is a specific technique to do that. So I'm going to describe this breathing technique to you, then I'm going to demonstrate it to you, and then I'd like us to do it together. So let me first tell you how it's done. In this exercise, you're going to breathe in quietly through your nose, and you're going to exhale forcibly through your mouth, blowing air out, like, and making a sound as you do so. So the exercise begins by letting all the air out through your mouth. Then you close your mouth, breathe in quietly through your nose to a count of 4, hold your breath for a count of 7, and blow air out through your mouth to a count of 8. And then you repeat this for a total of 4 breath cycles. It takes almost no time, about 30 seconds. So let me demonstrate this to you, and then we'll do it together, and I'll count for you, so at a rate that I think will be moderate. So this is what it looks like. That's all. It's a little hard for me to come back and talk to you after I do that because this produces a very pleasant altered state of consciousness that I would rather stay in. You may not experience that the first time you do it, but it is one of the rewards of practicing this technique. Do not do more than 4 breaths at one time. You can, however, repeat the exercise as often as you like. After a month, if you're comfortable with it, increase to 8 breath cycles, and then that's the absolute maximum. So then the practice is 8 breath cycles, a minimum of twice a day. After the changes, the physiological changes of doing this become apparent after, I would say, usually 6 weeks of doing this regularly. And after a month or so, try using this exercise for things. If someone cuts you off in traffic, if somebody says something to you that angers you, before you react, do the breathing technique. This is a very useful way to deal with cravings for anything that any habits that you want to stop, whether it's a cigarette, a piece of chocolate. When you have the craving, do the breathing exercise. By the time you get back, the craving will be gone. But the most interesting changes are the ones that happen physiologically. I have had patients who have had cold hands all their lives, who now have warm hands just as a result of doing this. Cold hands in a normal temperature environment are a sign of overactive sympathetic nervous system activity because the sympathetic nervous system constricts blood vessels in the surface of the body to divert more blood to the brain. So a manifestation of a parasympathetic response is increased circulation to the surface of the body and warm hands. I have people who have had chronic digestive problems that have resisted all sorts of treatment who now are fine simply as a result of doing the breathing exercise. I have 5 cases of people who've stopped atrial fibrillation by doing this breathing technique, something I wouldn't have thought was possible. This is also the most effective anti-anxiety measure I have ever found. It makes the drugs that we use for treatment of anxiety disorders look pathetically weak by comparison. And interestingly, the subjective experience in an anxiety attack or a panic attack is of being out of control. If you treat this by giving a person a sedative drug, like a benzodiazepine, it reinforces the idea that the locus of control is outside of you. But if a person learns that they have within them the controls that can stop anxiety, it's very empowering. And this technique becomes more powerful with repetition, whereas when you use a drug from outside, the effect becomes less powerful, and often there's a need for increasing doses, which leads to dependence. So I would just offer this as an example of one of the kinds of things that we in integrative medicine can find that's not really even on the radar of conventional medicine, and we can bring this into conventional treatment. And think of how many adverse drug reactions could be avoided. How much money could be saved just by teaching people this simple breathing technique. I've taught this to all the people that come through our fellowship training. Many of them are now using this with patients in all sorts of clinical settings and in all sorts of specialties, both in acute surgical cases, in emergency rooms, with pediatric autoimmune diseases, and reporting great clinical success with it. So to me, this is a prime example of what I mean by an integrative treatment that broadens our approach both conceptually and practically. But I'd just like to leave you with this thought. In English, the literal meaning of the word conspiracy is to breathe together. So that by doing this, we have been engaged in a conspiracy, I hope, for better health and better health care in the future. Thank you.